Hello, everyone, and thank you for joining us for today's Certified Healthcare Reform Specialist webcast. This webcast is planning to educate you as the agent, broker, and consultant on how to advise employers about this legislation. In addition, as the employer, how to advise your C-suite and how to strategically engage your employees. I'd like to take this opportunity to introduce the president of the Healthcare Reform Center and Policy Institute, as well as the editor-in-chief of the Healthcare Reform magazine, our president, Jonathan Edelheit. Jonathan?
I appreciate everyone taking some time to come on to our webcast today about the Certified Healthcare Reform Specialist. I know today we have on the call a lot of people from the industry that are interested in learning more about the certification, and also we have some of our graduated students on the call too who are here to also learn about some of the updates with the program. So we'll be walking through a little bit about the program, what it provides to you as a student, and then what are some benefits and really how to get the most you can out of the program. And the Healthcare Reform Center and Policy Institute is the only nonprofit, really, think tank, thought leadership organization in the industry, run by really the national practice leaders in healthcare reform, and its whole basis is to provide education and updates regarding the law, and then to take a nonpartisan approach in providing guidance on any changes that may need to take place with the law to make it a little bit more effective. So one of the main reasons I think that a lot of students are going through the course, it's not just about getting the designation and the certification. This program is the first certification in healthcare reform in the country. It was developed over the past several years, and it's really been grown each year and really expanded as the law has become more clear. But one of the biggest benefits of the course is really setting yourself apart from the crowd. And the reason why that's so important is I would say the majority of people out there, especially in this insurance agent and consultant marketplace, are telling people that they're experts and they've read the law. And most of you on this webcast today are probably very familiar with, some of those individuals where you can tell that these people don't know anything about the law, but they're still telling people that they're experts. They're telling people that they've read the entire law, that they're staying on top of the updates. And I know some of the research we've done is about 80 to 90% of human resource professionals are not experts on the law. They haven't really read or done any kind of advanced training. And even with insurance agents and consultants, there's a preliminary understanding, but up to 80 to 90% don't really understand the law fully and haven't had really advanced education, because there's a lot of details regarding the law, there's a lot of rules, there's a lot of regulations, there's a lot of updates, and unless you're actually daily staying on top of the law, you won't know some of these changes, and some have a really big impact. So about a year ago, there was FAQs released by the HHS. And in those rules, they were basically regulating the law and creating new rules and regs without even doing that, just through the form of an FAQ. And there was a thing called a Q7, which potentially eliminated all the limited medical and mini-med plans and gap plans by them issuing the question 7 with guidance that these types of plans are not allowed. And there's been some lobbying since then to really protect that, but if you were not in that tight circle of staying on top of the law and what was going on, you would miss that Q7, those FAQs, and you might actually be giving bad advice to your employer clients, or if you're an employer, you could be in violation of the law. We did the research about, I would say about 30 to 45 days ago regarding some of our students who've gone through the program, and the statistics that came back in surveying them is 95% of the students believe their designation created more opportunity to generate new or maintain existing business relationships. 98% felt that CHRS made them a better or more successful agent or consultant, and 98% felt it helped them attain new clients and replace other agents and brokers who aren't certified. We've actually had employers go through our certification because their local agents are not getting certified or educated. And one thing about our program is it is actually a certification, and it is actually a designation. So it's not a certificate course. It's actually a designation where you become a certified healthcare reform specialist, and you're unique in that is, certified healthcare reform specialist is trademarked by the Healthcare Reform Center and Policy Institute, and so is the term healthcare reform certification. So only those students who have gone through this course are allowed to use that terminology. So you get to put the seal on your business card. Other areas that we recommend you really use it to really promote yourself once you've gone through the course, is putting it on your LinkedIn profile, putting it on Facebook. If you have a Twitter account, tweeting about it so people know that you're an expert, because people are searching for people with this. So if you're searching on Google, you can, we'll go into our search functionality later, how people can find you on our website, but they can find you on LinkedIn, they can find you on Facebook, and I know LinkedIn things are searchable now, so you can even Google search and find someone who's certified through Google. We have a search functionality, and we do a lot of promotion of those people who've gone through our healthcare reform certification during the year. So you can go online into our website and type in a city or a state, find someone who's been certified, and then you can actually, through the system, send them a private message. So I think it's a way where people can help connect and find experts, whether it's an employer looking for an agent who's an expert, an insurance agent looking for another insurance agent who's an expert. It's a really great tool, and it's a great way to really maximize it. And then we market that through our website, through our magazines, and through our social media channels. And the Healthcare Reform Center and Policy Institute, we're actually now the biggest educator and influencer on healthcare reform, especially online. We reach, through our magazines and other channels, about 500,000 HR and insurance professionals in the U.S. If you're not a member of our LinkedIn group, we run one of the biggest insurance LinkedIn groups in the U.S. It's specifically on healthcare reform, and we have about 23,000 HR and insurance professionals who are in that group, and it grows by about 1,000 a month. So we also promote those people who've been certified through our social media channels. You automatically will get a diploma, a Certified Healthcare Reform Specialist diploma, which you can put on your wall, which shows that you've been certified. You bring your clients in your office, or to show to your colleagues that expert designation that you have. We also provide you some tools, and we're expanding the tools. So once you become certified, for example, we have a broker of record letter that we have provided where you can hand that to employers. And that broker of record letter really explains why employers and HR professionals should work with you, and why working with someone that is certified is really critical from an employer standpoint. And I think what we're also going to see is we're going to see a lot of litigation starting in 2014 of employers getting hit with fines, and employers terminating brokers, and also, unfortunately, litigation against brokers and agents by employers. Once the employers are hit with fines for noncompliance, once they find out that that agent did not advise them properly on the measurement period, and therefore now that employer is locked into how many part-time and hourly and how many full-time employees they have, and they have to wait a whole another year until 2015 to make that change, we're going to see some really big I think negative repercussions happening in this coming year with the law, because I think there's a lot of people who have sat and waited and said, I will wait to learn about it, or someone will teach me. And then I think the worst misperception out there, and I think it's a minority now, is that somehow this law is going to be delayed or changed. Because that boat left a long time ago, and there is absolutely no organization that's lobbying for the repeal of the law. So everyone voted for it, the insurance agent associations, the American Medical Association, the American Hospital Association, insurance companies, pharmaceutical medical supply, they all voted for it. Nobody's trying to repeal it, and even on the Republican side, it's been very clear that they don't plan on repealing it. No one's going to tell people who are sick, you don't have coverage anymore, or hey, you have dependents, your kid who's 25 is on your plan, we're going to remove that. Someone who has cancer no longer is going to have coverage. It's not going to happen. Billions have been invested in it, and it's here to stay. There might be some tweaks and changes that'll happen over the next year or two. Even though there's been some slight delays, the law is here, and it's here to stay. And the longer people put off and really trying to get educated on it, it's going to be much more difficult to stay in compliance and stay on top of it, because we'll go into that in a couple of slides. So the course right now is 17 core modules of education, and you can do it online at your own pace through our online learning management system, or you can do it live. And live, you can do it at our conference, which this year will be in Washington, D.C., September 20th through the 24th, or at any of our group certification training programs. So we do group trainings around the program, around the country live, and you can always participate in one of those to get your course live. But a lot of people are doing it online at their own pace. It's really neat to see, some of the educators we have in there. You can listen to the big three, which is the DOL, the HHS, the IRS, who've just been added to our course, just a few weeks ago with updates regarding the law. So one thing that makes our course, I think, really special is our diverse faculty. Our course is not taught by your peers or colleagues. These are the absolute national leaders in the industry. These are the practice leaders who are actually involved with the creation of the law, with the rules and regulations, and also in regards to who are governing the law now. So some of those faculty members where you're going to see who are instructors of it, the American Medical Association, Seyfarth Shaw, Mintz-Levin, Deloitte, Venable, Proskauer, and recently just added the Internal Revenue Service, the Department of Labor, and the HHS, all giving guidance about new updates regarding the law and what's coming in the future. So the course is constantly updated. Our course book is always updated, and we're always doing updated webcasts. So I think it's really unique because when people ask you, how did you learn about the law, it's not, oh, I went down the street and I learned from a colleague or I watched the webinar online. I've actually learned from the person from the Department of Labor who's putting forth all the rules and regulations regarding healthcare reform. That's who I learned from. Or I learned from the person at the HHS who's in charge of the marketplaces and the exchanges. And that's who I learned from. And I learned from the person at the Internal Revenue Service who's actually in charge of all enforcement of fines and mandates from the IRS for noncompliance. So it's a really powerful faculty, and it's kind of invaluable to learn from those people. As I said, we have group live training, it's a great tool if you have an agency or an association or a big HR staff within your company. We have 12 national CE credits that are available for member participants. When you do our certification, there's SPHR credits for HR, and then there's credit for agents who go through the program on a national basis. So we can do these group trainings to help build membership, or just if someone wants it in a smaller group within their offices, and it can be live, or we can do that training online for groups. And the training is customized. We've done training in California and Texas and Louisiana to some really large sold-out groups. This is just a quote for those of you who might be interested in kind of going through a group training. Craig, who is the president of San Diego Association of Health Underwriters, has said in here that they looked at different possibilities for advanced education and healthcare reform law, and it was clear the CHRS program was the answer, and it's the most comprehensive program out there, and an opportunity for their members to learn through interactive live instruction by some of the nation's top experts in healthcare reform. And, at the bottom right of all our slides, you'll see kind of our tagline with our program, which is current, comprehensive, and live. So we always try to, make our program, we update it as soon as changes happen. Here are some recent testimonials from students. I think those are always really important. So it's not us saying it, but students. But Tony, who's a CHRS graduate from Massachusetts, sent us in a testimonial that he just brought on 2 new clients using the skills acquired through the CHRS program, and it's really helped with his visibility and allowed him to become a speaker on healthcare reform. And then Annie from Florida Said certification has helped me open doors which were difficult to get to. And then employers and business owners have demonstrated a higher level of respect and appreciation for the HCR guidance as a certified healthcare reform specialist that they're offering them. And that's just common sense. I look at the example of if your car broke down at the corner of a major intersection where you live, and you need to go to a mechanic, and there are two mechanic at gas stations on each side of the street, the north and south end of the street, and one says certified mechanic and one just says mechanic, you're going to go to the one that is certified. Now, if we look at the ACA law, this is actually a picture from Senator McConnell's office that he took of the law a couple months ago. And it's very interesting because there's a lot of information that's being held back on the law. No one can actually tell us, even to this day, how many pages there are of the law and the rules and the regulations. And you get all different answers. And then when you look at how many pages the federal the Federal Register is, which is the books that the actual law goes in, it's very tiny print. So it's actually 4 times that in a normal one-page document. But the reports are it's up to about 20,000 pages. So there's about 381,517 words in the actual healthcare reform law, the ACA. But there's an estimated 11,588,500 words in the rules, regs, and other attached, it could be private judgments and others surrounding the law. So that means the regs are 30 times as long as the law. So as an agent, as an employer, how are you supposed to be on top of 20,000 pages or almost 12 million words, knowing that every single day there's more rules and regs that are pushed out? It's impossible for you to stay on top of it. There's 109 final regulations and up to 180 intergovernmental bodies and federal policy developers and these little coalitions and think tanks within the government that are actually coming up with the rules and regs. So it's impossible on your own. If you're an agent, if you're an employer, there's no way that you can stay on top of the law on an ongoing basis. And there's no other course or program out there to help you do it. Also, when we go back to this law right here, go back to this picture. If I wish I could I could do a poll right now, but if I could, the one thing I would ask you is how, the law is not really fully funded, meaning they don't have the full funds to actually administer and run the law going forward, and it's going to require a lot more money than it's supposed to. Right now, there was a report today that it's estimated that for every single person who enrolled under the new law, it costs about $15,000 because of all the technology and investment. And we can't even get the real statistics on how many people have enrolled in the law because they're being very careful with what numbers and information they give out. Just today in the Wall Street Journal, there was a whole article about that the numbers can't be trusted and there's not a lot of transparency regarding what's going on with the law and how many people are enrolled. But how are they going to fund the law? So the real answer is they're going to fund the law through fines. That is the whole plan and initiative of the government. And it has already started to happen. And this guidance and information has come directly from our contacts, not only within the administration, but all of our instructors and faculty for our CHRS program. They're the national practice leaders at the top law firms involved with healthcare reform and dealing with the HHS, IRS, and DOL on a daily basis for their clients. And their clients are already starting to get hit with fines because that is the strategy that is going to be used to fund the law. So one of the biggest areas that's not even talked about right now is data privacy. So in just one area, healthcare reform is going to be heavily subsidized through data privacy fines. Now, the next great question I'd like to ask, and I wish I had a poll for this, is how much do you think that fine is on average every time an employer gets hit with it? The answer is $1 million. So when there's an employer who has a data privacy violation, HHS is hitting them on a minimum and on an average $1 million in every single case. No exception. And I will give you an example of that. And this is not an employer example. This is a health plan example. A health plan recently had a photocopier in their office, and it was one of those things that was like a 5-year lease. And the lease ran up. They gave the photocopier back to the photocopy company, and they got a new photocopier. The company they rented it from went ahead and pulled a hard drive from the photocopier. The health plan had no idea there was a hard drive in the photocopier they had rented. Wasn't part of the agreement, was never explained in the sales process. That company then reported it to the HHS and provided the hard drive to the HHS. That health plan was hit with a $1 million fine. And that's circling around with a lot of the national attorneys involved in healthcare reform. So the thing about this is you need to stay on top of what's going on, and this is not something to mess around with, and the repercussions are going to be huge for violations. We had a private roundtable that's the first that's ever happened in the country at our conference that we just had in Las Vegas this November with HHS, DOL, IRS, and we had about 20 large employers. And it was an informal meeting where the employers could ask questions to the big three, any questions they had regarding the law. And it was great to see the dialogue, the questions that the employers were not familiar with, and how the government wanted to be able to hear and have a forum where they could find out the challenges employers were having. And in that, it was very fascinating, and we'll be releasing some of this information through some further webcasts in the new year to educate our CHRS students, is the IRS talking about how, that $1 million fine example is nothing. That there are certain ways that the majority of people don't even know they could violate the law that can have a penalty of up to $20 million for an employer or a health plan. So a lot of this stuff is not being published, it's not out there, and also if you look at from a governmental perspective and the Obama administration, right now they're trying to put a very positive spin on the healthcare reform law. They've gotten healthcare.gov to work, they're saying that people are getting into the exchanges. Do you think they're going to go out there publicly and say, we have created fines of $1 million to $20 million and we're already starting to fine people? And then those companies that get fined, do you think they're publicly out there telling people, if you're an employer or health plan, are you going to go tell everyone, hey, we just had all of our members and insured's private medical records on a hard drive that some photocopier company got and we got fined $1 million. They're not going to share it. So it's really important to stay on top of things because you're not going to be reading about this stuff in the paper and no one's going to be out in front really talking to you about it. So some of the lessons of the CHRS program, that you'll get through the course is, some of our, as I was saying, some of our speakers is, you'll get influential federal authorities. We have perspectives from the HHS, DOL, and IRS, from Phyllis Borzai, Assistant Secretary for the Employee Benefits Security Administration with the Department of Labor, Alan Tushunsky with Deputy Association Chief Counsel at the Internal Revenue Service, U.S. Treasury, Kristen Link-Young, Director of Coverage Policy of the Office of Health Care Reform, the HHS, which she's in charge of exchanges. We try to, through the course, give you a background of starting out at the examination of the Supreme Court decision. I think it's important to understand why they upheld the constitutionality of the individual mandate, what the Supreme Court really decided, what the judges, even the majority said, what the dissenting side said. So you have that background so you can really understand the legal background of the law, but also you can have intelligent conversations. We cover private health insurance exchanges and the marketplaces, the pros and cons, the state and federal exchange marketplaces, how states have taken different paths on the exchange, which are doing state, which are doing federal, which are doing partnerships. We cover the impact of the employer mandates on employer-sponsored group plans, and we also go in with those mandates, what are the fines, full-time versus part-time versus hourly, how they calculate that, how are there ways you're going to get fined, the measurement periods of when you're going to establish those classes and how the IRS is going to require 12 months to determine that whether they're full-time, part-time, or hourly, and that's why, a lot of employers have until the end of the month, if they haven't made those designations, they're going to be locked into those that status. So if they try January 3rd potentially to say, well, this person's now, I'm going to classify these people as part-time or 1099, the IRS starting in 15 are going to say, sorry, nope, you waited too long. And also, the question is, how are you going to really measure and report and keep record keeping of all those people? So the IRS, just like getting an audit on your taxes as a company or an individual, they're not going to come to you January 1st of this year and say, please provide us reporting. They're going to come in 2, 3, 4, 5 years later and say, provide us reporting, and we are going to look at the past 3 or 4 years, and we're going to determine if you are in compliance or not. The Healthcare Reform Center and Policy Institute, we just partnered with an organization called WorksTime, which is a healthcare reform technology company, which has actually created a system where employers, through technology, can be sending their payroll information on a weekly or biweekly basis, and it will automatically kick back whether someone is in compliance or not, or whether someone's going to be moving into the full-time status, or whether you're going to have a chance to get a fine. So it's really great technology, and we've negotiated a special price for CHRS students with that technology, where they'll be able to offer to employers for a lot less than people who are not CHRS certified. And I think programs like that are really sophisticated because it's an outside independent company that allows you to provide reports to the IRS, and it allows you to set yourself apart. So there's a big insurance company that actually just licensed the whole software system I think it was for like 30 or 50,000 of their agents, for them to offer it with their voluntary benefits, because they realize it's a competitive edge to be able to go into an employer and say, hey, I'm certified, and I'm going to provide you this software where you no longer even have to worry about, are you in compliance or not? The software is going to do it for you and let you know, and then it's going to provide that backing if you ever get audited by the IRS. If I'm in HR or I'm an employer, I'm going with that. Why should I have to stress out on a constant basis? And the challenge on the employer side is a lot of times you have the benefits person saying, oh, payroll is dealing with compliance with healthcare reform, and then the payroll person saying, no, benefits is dealing with that. Another thing that we talk about, covered by the CHRS program, is the taxes, all the taxes involved in the healthcare reform law. Decisions and opportunities, how employers should make decisions, whether they provide coverage or not, and dealing with the mandates, what's next for healthcare. So, we have Peter Carmel, president of the AMA, talking about what's coming for healthcare in the U.S., IRS guidance on full-time employment status. Really important, this module is strategically communicating with employees about healthcare reform. I think it's really... Hello, everyone. I apologize for that. We're back on. Just some technical difficulties. Dropped off for a second. So to continue the PowerPoint. So I was talking about the strategically communicating with employees about healthcare reform. That's one of the modules. I think it's really important. There's not a lot of communication or education going on out there. The insurance companies aren't taking a stand on it. And, it's very obvious when you talk to individuals on the street or employees at a company, nobody really knows what healthcare reform means. And if a perfect example of that is the Jimmy Kimmel video, if any of you saw that, what do you like better, the Affordable Care Act or Obamacare? And a lot of people saying they like the Affordable Care Act and they don't like Obamacare. People think it's free healthcare or surgery or free surgery, so it's really important to understand and to learn how to strategically communicate so they get engaged. We have another module, which is a sea of change in employee benefits, about how everything is changing and what's affected. We cover wellness, essential health benefits, cost sharing, and minimum value. We have updates on controlled groups and providing minimum essential coverage, and I think those two are very important. The controlled groups are very important. There's a lot of people trying to get out of providing healthcare reform, specifically because of saying we have multiple different companies, but they don't realize that they're in a controlled group, and that makes them a large employer with 50 or more employees. We cover in one of our other modules, fiduciary fundamentals under ERISA. And this is very important because there are a lot of fines that take place now that weren't there before on ERISA. So now there are fines, that could be $100 a day per employee that now are really going to be enforced, and it's going to be a way the government funds and subsidizes healthcare reform. So there's been a lot of really investigators that have been hired by the government to go out and to do audits and find out violations under ERISA and to start fining employers. So it's going to be very important to have a fundamental understanding about liability and how you can violate ERISA and to stay in compliance. We cover healthcare reform's expansion of wellness incentives. So we cover, how the government is allowing you to incentivize employees more to wellness, how you're able to incentivize them more or as they say, offer a penalty depending on the way you look at it. So the healthcare reform law is a big supporter of corporate wellness programs, and we're going to see expansion of corporate wellness programs under healthcare reform. There's healthcare reform's effect on self-funded plans. So we're seeing a huge trend of self-funded plans take off under healthcare reform. And we're also seeing a lot of small group self-funded plans come into play. And then we're seeing some states a little bit having a backlash of those small group plans, like California. They just regulated as to what size you could go down through to self-funding, because a lot of people are using the self-funded plans to get out of some of the additional mandates, and because of lower taxes. So we really talk about how the ACA affects self-funded plans. There's a module on opportunities in healthcare for small business and how the healthcare reform law applies to small businesses. One of the most important things about the program is it's all about continuing education. Your designation doesn't stop once you get it. We have webcasts and updates throughout the year where you can get them online complimentary, and you can also get updates of CEs at our conference. And we require continuing education of 5 hours per year each year. And the reason why we do that is the law is changing so fast that you need to stay on top of the new current rules and regs and what has changed. And we don't want anyone to have our designation or our seal that they're not staying on top of the law. There's no point in having any kind of a certification that you get it and that's it. So you take the exam, you pass the exam, and you get your designation and certification seal, but then you must continue maintaining your continuing education units every year, of which you get CE from the state level if you're an agent, or you'll get your HR credits that we get through CHRS. So this is a little bit of a summary of everything that is kind of covered by the course. I won't go into it. We just have a book we just released, Healthcare Reform, Reality and the Practicality, which is now a part of the course. It was published November 2013. It's about 161 pages. We had about 40 experts in the industry contribute to this book. So this is really a supplement to our course to really help people understand and learn the law. Some people prefer reading versus watching online video, but so this provides a little bit of both. Also with the course, there's a workbook that you get that you're able to use to go we'll go through the course as you're watching the videos online or if you're doing it in person. You can get the certification, as I said, you can get it online. The course is $9.95 right now. It'll be going up in the new year. It'll be going up a little because we're adding a lot of modules and some new special things for the program. And you can go for more information on it or sign up. Our website is healthcarereformcertification.com. That's healthcarereformcertification.com. And then we've had some feedback recently of a lot of students being very proud of the program and wanting to show clients beyond the business cards and beyond being on their social media. So we've created some other products and things that you can get from our the Healthcare Reform Center and Policy Institute store. So we have some mugs, the CHRS mugs. We actually have our CHRS pins that you can wear. We gave those out for free to all our students at our conference, but they'll be at our online store. And then we have some sweaters and apparel. So if you want to go take your client out golfing, I know it's a little cold now in the Northeast, but if you're out in the Southwest or the Southeast or coming for this spring, Miguel on the left there, who's our Healthcare Reform Certification Coordinator, that's him modeling our gear. And he has his own jacket, and he's very proud of it. You can tell from the smile on his face. I hope for those of you at your conference were able to meet Miguel. So this is our program, the CHRS program. Anyone who would even like us to walk through the actual online learning management system, to walk you through it, to see how it works, because most people want to do it online. For those of you who might be interested in getting group certification for your company, there are special discounts. You get a certain number of people, a certain number will get complimentary. But we can create very customized packages, and then depending if you're in a certain state, we can even have specific training on what's going on within the exchanges within your state. But one of our big things is we're constantly changing the course, constantly updating it, and then we have a huge campaign this year to market those students who've gone through CHRS. So I think it's an excellent investment. I think in the long term it's extremely affordable, and I think that the most important part is you have to set yourself apart. A lot of people put their heads in the sand with the law, and now it's starting, the measurement period starts in a couple weeks. Everybody's going to realize that now, 2015, the employer mandate kicks in. We've now really got to start getting on top of the law, and everybody's going to be out there saying, I'm an expert. I went to a 1-hour seminar. I went and got a certificate from, ABC, local company. I don't need anything more, and I'm going to start telling my clients that I've read the law and I'm an expert. And you need that independent source to say that you have something that vets you and that says that you have minimum standards and you have a higher level of expertise. So with that, I'd like to thank everyone for being on the call, and I will turn it back over to Jenny Dodson.